In 1948, the United Kingdom launched the National Health Service. Its founding principle was radical for its time, that healthcare should be free at the point of need, available to every person regardless of their wealth or background. In 805 CE, over 11 centuries before the NHS, the Abbasid Caliph Harun al-Rashid opened a hospital in Baghdad with an identical mandate. It provided free treatment for every patient, with no distinction between rich and poor, local or foreigner. The Bimaristan, a Persian term for the place for the sick, operated as a sophisticated healthcare network. These institutions housed specialized wards, full-service pharmacies, and a medical staff that students today would recognize as residents. The foundational ideal of the modern public hospital is a medieval Islamic innovation. Before the Bimaristan, healthcare was fragmented. In the Roman world, medical care was the responsibility of the family or the military. Their valetudinaria served soldiers exclusively, with no civic obligation to treat the general population. The Greeks relied on asclepions, which functioned as religious healing sanctuaries. These were spaces for spiritual intervention and divine dreams, rather than systematic clinical medicine. Byzantine Xenodokia offered refuge to the destitute and travelers, but they functioned as charitable shelters. They lacked the rigorous medical programs that would define the Islamic system. Creating the Bimaristan required an evolutionary leap past these models. To build a permanent, public, and scientifically driven hospital, the Abbasids engineered 3 distinct engines. Before this moment, a healthcare institution of this scale, funded independently of the patient's wealth, did not exist anywhere on Earth. The first immediate challenge was staffing. A massive public institution requires qualified clinicians at a scale the ancient world had never seen. The Caliphate addressed this by sourcing expertise from Gundeshapur, a Persian medical school that had already begun synthesizing Greek, Persian, and Indian medical traditions into a single discipline. This synthesis was intentionally cross-cultural. Caliph Harun al-Rashid appointed a Christian physician, Jibril ibn Bakhtishu, to direct the first Baghdad hospital, leading a staff that drew from multiple faiths and ethnicities. During the Abbasid Golden Age, medical science was a universal human good. Caring for the sick was an obligation transcending all religious boundaries. For a public healthcare system to function, patients must be able to trust the standard of care provided by the state. In the 9th century, a physician named Ishaq ibn Ali al-Rahawi wrote the Adab al-Tabib, or the Conduct of the Physician. This document formalizes the first written medical ethics code, establishing rules for patient confidentiality and the duty of honesty in prognosis. In 931 CE, after a patient in Baghdad died due to a physician's error, Caliph al-Muqtadir moved to turn these ethics into law. He mandated the first medical licensing examinations in history. Within 3 years, over 860 practicing physicians in Baghdad had been examined and licensed to ensure they met a minimum clinical standard. Legally requiring a doctor to prove their competence before treating a patient was a 10th century Baghdad invention. This raises a critical economic question. How did these hospitals remain free for centuries without the taxation models used by modern governments? They used the waqf, a charitable endowment. Donors dedicated revenue-generating assets, like farms or shops, funneling all income into medical care. Crucially, a waqf was legally inalienable. It could not be seized, creating a permanent, self-sustaining financial engine that funded hospitals regardless of political shifts. In Cairo, the Bimaristan al-Mansouri utilized this system to support 8,000 beds. It provided free medicine, clean clothes, and even recovery funds for patients returning home, all funded by its original endowments. By engineering a legal mechanism to tie commercial assets to a permanent public service, the Islamic world provided the structural logic for modern hospital trusts. Today's nonprofit healthcare systems rely on this same inherited financial architecture. As the Bimaristan model matured, the network allowed for specialized departments that changed the trajectory of medical history. While much of the world treated mental illness as a spiritual or supernatural failing, the Bimaristan system established the world's first clinical psychiatric wards. At the Bimaristan al-Argun in Aleppo, physicians used environmental therapy, running water, natural light, and musicians playing calming music. They had concluded, through observation, that a patient's physical and social environment directly affected their recovery. This clinical understanding of psychiatric care predated Western asylum reform movements by nearly 1,000 years. This system reached Europe through 2 channels: direct observation by crusaders like the Knights Hospitaller, and the translation movement in cities like Toledo. These Arabic medical texts and institutional models became the foundation for the first European medical schools in Salerno and beyond. In 1284, the charter for the Mansouri Hospital in Cairo stated that all costs were to be borne by the hospital, with no conditions of payment and no distinction between the low or high, rich or poor. That charter and the 1948 NHS charter are separated by 664 years, but they articulate the exact same moral commitment. The modern world is still debating who is entitled to healthcare and how to fund it. The Islamic world answered those questions in the 9th century, then built the institutions to prove it could be done.